Which antibiotic is best for your UTI, broad or narrow? When it comes to treating urinary tract infections, choosing the right antibiotic can make a big difference. You might wonder whether broad-spectrum or narrow-spectrum antibiotics are better. The answer depends on several factors, including how certain your healthcare provider is about the bacteria causing the infection and the severity of the illness. Narrow-spectrum antibiotics are usually preferred for uncomplicated urinary tract infections. These drugs target specific bacteria, like Escherichia coli, which is the most common cause of UTIs. When local bacterial susceptibility data shows high effectiveness, using narrow-spectrum antibiotics like cephalexin can be very successful. They work well and help preserve the body's normal bacteria, which is important for overall health. Research shows that many hospitals report over 80% of urinary pathogens are susceptible to narrow-spectrum antibiotics. This makes them a good first choice for uncomplicated cases. Plus, using narrow-spectrum drugs reduces the risk of developing antibiotic resistance, which is a growing concern worldwide. Broad-spectrum antibiotics, on the other hand, attack a wider range of bacteria, which can be helpful if the infection is severe or the exact bacteria are unknown. But overusing broad-spectrum antibiotics can lead to resistance in many bacteria, not just the ones causing your infection. In clinical practice, studies have shown that treating uncomplicated UTIs with narrow-spectrum antibiotics often results in shorter hospital stays and lower healthcare costs. They are just as effective as broad-spectrum options for most cases, without the added risks. Broad-spectrum antibiotics are typically reserved for complicated infections or when initial treatment is started before lab results are available. It's important to follow antibiotic stewardship principles, which means using the right drug at the right dose for the right amount of time. This approach helps prevent resistance and protects your overall health. When your doctor orders a urine culture and sensitivity test, they can tailor the treatment to the specific bacteria involved, often switching to a narrow-spectrum antibiotic once they know what's causing the infection. For bladder health and bladder cancer patients, avoiding unnecessary antibiotic use is especially important. Repeated or inappropriate antibiotic use can disturb the bladder's microbiota and potentially impact bladder health. For those undergoing cancer treatments, careful antibiotic choice is crucial to prevent infections without promoting resistance or interfering with therapy. In summary, for most uncomplicated urinary tract infections, narrow-spectrum antibiotics are the best initial choice. They are effective, cost-efficient, and help reduce the risk of resistance. Broad-spectrum antibiotics should be used only when necessary, such as in severe or complicated cases or when the bacteria are unknown. Always consult your healthcare provider for personalized advice, and remember that treatment decisions should be based on local bacterial patterns, your medical history, and lab results.